Hi, this is the Common Sense Doctor, and I want to do a follow-up on strep throat that we were talking about the other day. Strep throat is caused by Streptococcus. Now, Streptococcus is a genus name, and within the genus are a lot of different species. So the specific strep that causes strep throat is group A beta hemolytic strep, or also known as strep pyogenes. Now, strep throat classically presents with a nasty throat, really hurts, and adults feel like they've been hit by a truck. In a classic presentation, the tonsils are red and swollen, may or may not have pus, you may or may not have petechiae on the roof of your mouth, and you may or may not have swollen nodes. But that's just the beefy red throat. We look and go, oh, well, we know what you have, okay? Now, strep throat, though, can present after the initial infection with different groupings. So any two of the following 7 symptoms can present, and it should, at least if you've had it before, go, we should think about strep. Now, right now, strep is more rampant than it's been since the pandemic started. So I think it's very pertinent to know these 7 symptoms because some of them can just look like a virus. But if there's been strep at school or you've had it before, we can test easily for it, right? The 7 symptoms are headache, stomach ache, fever, sore throat, vomiting, diarrhea, and rash. So the rash is a very fine sandpapery rash that's kind of red, just sort of looks like you got like a sunburn. And that's called a scarlatiniform rash, which means we call it now strep throat with a rash or scarlet fever. Scarlet fever is easily treated, as is strep, with antibiotics. We can also use homeopathic remedies as well. Actually, specifically in this case, homeopathic belladonna works great, okay, with the nasty red throat, the rash, okay? But we use antibiotics as well with scarlet fever, and that rash may peel in the healing process. So headache, stomach ache, sore throat, fever, vomiting, diarrhea, rash are the 7 symptoms. You may come in and go, hey, I just have a stomach ache and, diarrhea. And we go, oh, it's a stomach bug. Right now, test for strep, just to be sure, all right? Now, there is another family member, which is far more nasty, and it's strep pneumonia. So the Streptococcus genus has a lot of family members. There's strep viridans, group B strep, strep pyogenes, strep pneumonia, strep oralis, strep pharyngeus, strep mutus, strep mitis. There's a whole lot of different ones, okay? But the 2 we're focusing on are group A, beta hemolytic strep for strep throat, and then strep pneumonia, which is far more invasive. Invasive means it gets into the body. It can infect your blood, called bacteremia. It can infect your kidneys, called pyelonephritis. It can infect your lungs, called pneumonia, or your brain, called meningitis. Well, actually, the outer of your brain. Okay, those are all serious. And strep pneumonia, in its really nasty form, presents hard and fast. I've seen kids with just a cold, and they're getting better, and then day 4 or 5 suddenly develop a fever of 104, 105, and my first thought always is rule out pneumonia and rule out strep pneumonia. Strep pneumonia infections are treated with antibiotics. 100% we can use alternative or non-traditional solutions in conjunction, but an aggressive infection needs aggressive treatment. So hopefully this information is helpful. Oh, and also people who have no spleen, either from loss from trauma or born without a spleen, are more susceptible to violent infection from strep pneumonia. So people with no spleen are really recommended to get the Prevnar vaccine, which targets the strep pneumonia family. So I hope this information has been helpful. Group A beta hemolytic strep is what we talk about for strep throat, and then strep pneumonia, which is the more virulent form. So thank you for listening, and I will see you next time.